Xie Huang San, commonly translated as drain the yellow powder, is a classical traditional Chinese medicine formula in the category clear spleen heat. Its core action is to clear latent fire from the spleen and stomach while regulating Qi. The pattern framework is spleen-stomach heat with oral or digestive manifestations. This mini-lecture focuses on the formula logic, recognizable pattern features, and practical drug-herb interaction screening. It is an educational overview, not an instruction to self-prescribe. Start with the pattern rather than the disease label. The traditional target pattern is spleen-stomach heat with oral or digestive manifestations. Typical clues include mouth sores or foul breath, thirst, dry lips, irritability, red tongue, rapid pulse. These findings are not all required, and the same biomedical diagnosis can present with different Chinese medicine patterns. Conversely, these traditional signs can arise from multiple biomedical conditions. That is why pattern differentiation and conventional red flag screening should occur together. Key herbs commonly associated with this formula include Huomiang, Zhai Zai, Xigao, Gankao, Fang Fang. In classical formula analysis, some herbs address the principal mechanism, others support the chief action, and others harmonize or direct the prescription. The exact composition can vary by lineage, manufacturer, granule concentration, and modification. For interaction analysis, the actual ingredient label and dose are more important than relying only on the traditional formula name. The first interaction focuses Gankao and electrolyte-sensitive drugs. Licorice-containing formulas deserve attention during sustained or high-dose use. Glycyrrhizin can produce a mineralocorticoid-like effect in susceptible people, with sodium retention, blood pressure elevation, and potassium loss. That can matter with loop or thiazide diuretics, digoxin, corticosteroids, antiarrhythmics, and existing hypertension. The risk is dose, duration, and patient dependent. In practice, ask what prescription drugs, over-the-counter products, supplements, alcohol, caffeine, and other herbal formulas the person uses. A multi-herb product can create several overlapping mechanisms at once, so medication reconciliation is a core safety step. The second interaction focuses timing with oral medicines. Mineral-rich ingredients, such as gypsum, oyster shell, dragon bone, hematite, or similar substances can complicate oral drug absorption through binding, altered gastric chemistry, or simple co-administration effects. For medicines with narrow absorption windows or known mineral interactions, separating administration times is a conservative strategy unless a pharmacist or prescriber gives different instructions. The quality of evidence for herb-drug interactions ranges from pharmacology and case reports to controlled human data, and that evidence is uneven. Therefore, distinguish a proven contraindication from a plausible additive effect, and use monitoring where the uncertainty is clinically meaningful. Safety summary. Oral ulcers that persist, recur frequently, bleed, or occur with systemic symptoms should be evaluated for biomedical causes. Also verify species identity, processing method, contamination testing, and manufacturer quality. Stop and seek appropriate care for severe or rapidly worsening symptoms, allergic reactions, fainting, chest pain, major bleeding, neurologic deficits, or other red flags. Pregnancy, breastfeeding, significant kidney or liver disease, and polypharmacy warrant a lower threshold for professional review. A useful clinical checklist has 5 steps. 1. Confirm the traditional pattern. 2. Identify the exact product and full ingredient list. 3. Reconcile prescriptions, over-the-counter drugs, supplements, and other herbs. 4. Identify measurable endpoints, such as blood pressure, glucose, inner, electrolytes, symptoms, or bowel function when relevant. 5. Reassess after starting, stopping, or changing the formula rather than assuming the response will be stable. In summary, Xie Huang San is best understood as a pattern-based prescription, whose action is to clear latent fire from the spleen and stomach while regulating Qi. The key safety principle is targeted interaction screening plus objective monitoring when risk is plausible. Standard references for further study include Chinese herbal medicine formulas and strategies by Bensky and colleagues, Chinese medical herbology and pharmacology by Chen, and current drug interaction and pharmacology references.